welcome to the next presentation. What we're going to basically start to look at today is looking more at stretching and how stretching can actually affect the low back and how it's going to benefit the actual low back by implementing key stretching exercises, and also looking at the key muscles which you need to focus on, because there are certain muscles that people don't tend to consider. So that's one of the key things that we're going to actually take a look at today. Particularly by the end of the presentation, you'll start to have an evidence-based knowledge, particularly looking at stretching of the hamstring, the tensor fascial latte, and also stretching of the gastrocnemius muscle, which is going to be a very important muscle which you need to also consider, and one that generally tends to get overlooked. So any weakness or tightness within these muscles needs to be considered, and these are key things that does lead to chronic low back pain if they are actually overlooked. So if you start to look at main muscles, which is going to be your quadratus lumborum, your hamstring, your gastrocnemius muscles, your glutes, and also key muscles such as your psoas muscle, which is going to be quite an important one. I normally see people coming in with tight psoas muscles after they've been digging or doing a lot of digging in the garden. So they're ones, again, that can actually get overlooked, and also your tensor fascial latte. So again, one of the main things besides the tightness, when you look at some key things that's going to cause tightness. So let's say, for example, somebody sustained an injury, then that can activate trigger points. So you do need to focus on the trigger points. And once you start to look at key muscles that's going to house trigger points, that's going to be things such as your iliopsoas and your quadratus lumborum. Primarily your quadratus lumborum does need to be looked at, and also your gluteals. So they are what's going to cause your myofascial trigger points. Your myofascial trigger points will then cause even more shortening and tightness within those muscles. So it is important, in order to deactivate those trigger points, besides applying pressure or needling, whichever treatment modalities you're going to actually do, you do need to stretch them out pretty well afterwards. So again, if you do not actually stretch those back out, then that's going to start to give you a positive things such as your sit and reach test or your straight leg raises. So that's some of the things that you need to bear in mind once you're actually doing some of your assessments, and also once you're actually implicating some of your stretching techniques. So if we look at key studies that has gone out there and looked at stretching, just stretching in general, then you can see this particular study, what they basically did was to look at stretching exercises over an 8-week time period, and that was combined with education. That was compared to another group that used lumbar stabilization combined with back care education, and also a group which was used as a control, which was just primarily the back care education group. Now, these was 96 quarry workers that presented with non-specific low back pain. Now, the overall findings was after 4 weeks they found that the stretching exercise was significantly more effective and also improved pain and functional disability. And that was after 4 weeks, but after 6 weeks you found that the stretching exercises seemed to outperform the lumbar stabilization. So that's key important. But normally what I would say is, if you're going to administer any kind of stretching, pretty much like what I said when I was discussing the lumbar stabilization and strengthening exercises for the back, these should be in conjunction to each other. They should complement each other in your treatment modalities, and that's where you're going to get your best overall effect, and not use them as a single modality. But stretching should be an ongoing something that's ongoing as you discharge that patient. Make sure if they are susceptible to reoccurring back problems, they go away and continue to do stretching exercises. And same again, they also go away and do any kind of core stability and strengthening exercises. Therefore, they're less at risk of reoccurring problems. Whereas if you just treat them, discharge them, then they're at risk of problems representing itself. Now, if we start to look at the hamstring, it is important to consider the hamstring and look at tightness within the hamstring. And generally what you basically find is patients presenting with tight hamstring will start to present, if it's quite tight, it will start to tilt the pelvis posteriorly. Also, one important thing is if patients got really tight hamstrings, it's also going to affect gait, and it's going to cause what you call a sagittal block. Similar to somebody presenting with a reduced range of dorsiflexion in the hallux, or hallux limitus, come to that, that can also lead to low back pain because it's going to cause a sagittal block. In other words, the patient is going to take a shorter stride length. As they take a shorter stride length, it's going to cause muscles like the psoas muscle and the quadratus lumborum muscles to overwork. And then that can also lead to low back pain as it starts to pull on the vertebrae, those two muscles in particular. Now, tight hamstring is going to do pretty much the same. So it is important to stretch out the hamstring to reduce the forces of those muscles on the vertebrae. And several studies has demonstrated by stretching out those hamstring that it's actually going to start to cause some improvement in general low back pain. Now, as I was saying beforehand, two key muscles that's generally overlooked, one being the tensor fascial latte. If that's tight, it's going to cause internal rotation of the actual femur, particularly within the hip, and then that's going to start to aggravate the back in that respect. So it is important that you do stretch out the tensor fascial latte. Now, again, studies have gone out and demonstrated by stretching out the tensor fascial latte to reduce the internal rotation, particularly during gait, then that again will actually reduce the onset and also the symptoms of low back pain. In addition to the tensor fascial latte, you've got to take a look at the gastroc. Even though it falls further down the kinetic chain and it's not further up the kinetic chain, it will have an indirect impact on the back by causing more tightness within the actual hamstring itself. Now, one of the key things, let's say for example I have a patient who presents with Achilles tendinopathy. When I give them stretching exercises, I do not just give them the calf muscle to stretch. They need to stretch the whole kinetic chain because one will impact on the other. So it is important they start off at the glute, they stretch the glute, then they stretch the hamstring, then they stretch the actual gastroc, and by doing so will take a lot more stress off the Achilles and you're going to get a quicker and more effective recovery phase. Same thing applies here. If somebody's got a tight gastroc, it's going to reduce the ability for somebody to do a sit and reach test. So it is important that they stretch out the gastroc as well as the hamstring. If you look at key studies that's actually gone out and observed that, what you're basically finding is overall they've got an overall more of an improvement once they've actually looked at the groups where they've actually looked at stretching the hamstring as well as also stretching out the actual gastroc in itself. And also what they're mainly getting is an overall improvement in range of motion. This is another study that's gone out there, done pretty much the same thing. They've stretched, you looked at two groups. One group stretched out the hamstring. Another group has actually implemented the gastroc and strengthening exercises in both groups. But however, just one of the group are doing more stretching and strengthening for the gastroc, and you're finding the difference at the end in both groups. Even though they've improved, if you look at the significance of improvement, you're finding it's greater in the group that's actually done the stretching for the actual gastroc. Once you look at the pain aspects of it, group B that did the stretching for the gastroc had more reduction in pain in comparison to the group that didn't actually stretch the gastroc. So there again, do consider the gastroc when it comes to doing stretching exercises for actual low back pain, and don't just purely focus on the muscles within the back. So thank you for listening. I hope you go away, you find that useful, you implement it to the other modalities in which we've actually discussed with you, such as the strengthening exercises, and also look at the acupuncture as to how that's going to ease off, take some of the tension out of the muscles and allow it to improve in joint range of motion. Now, if you've got any questions, then by all means, you can email me at info@stevebailey.com, or you can post it in the back office within the group, and I'm sure either myself or somebody else may well get back to you and answer the questions that you may well have. Look forward to seeing you on other presentations.